grab yourself some refreshment during the break. I am delighted now to introduce Professor Jenny Pope, who, like me, has been involved in the SPHR since the outset, and she's made a huge contribution to the school as co-lead for Lilac and as Deputy Director in SPHR1, where she developed our incredibly successful FES funding scheme and led a research programme, and in SPHR2 when she led on our very important public involvement and engagement in SPHR research work, which she's going to talk to you about now. Lovely to see you, Jenny, and over to you.
Thanks very much, Rona. It's a pleasure to be here. Just to say, I'm recovering from COVID, that pandemic that many people seem to think has ended. So I'm just hoping my voice survives this 6 or 7 minutes. So yeah, I'm going to talk about our achievements in public involvement since we agreed and began to implement our strategy 2017-18. And then you're going to hear from some of our public partners about their experience of being involved in the school. And finally, Prof. G.J. Melendez-Torres, who's taken over strategic responsibility for public involvement from me now, will tell you a bit about the future. So what about our strategy? It has 3 really ambitious objectives. The first is to establish an organization which values and sustains trusting, respectful relationships between everybody involved, but particularly through our partners, our lived experience experts and the academics. So culture change. The second is to develop SPHR as an involving, inclusive organization. So that would be committed to providing a range of high quality involvement opportunities right across the school. And the third is to be a learning organization. That means collecting the kind of data we know that will allow us to continue to improve both the experience of public involvement, but also the impact of the people, the members of the public who get involved, and crucially, to use that learning to improve what we do. So the strategy has 43 separate action points, and we've delivered around 2/3 of those, and the others, almost all of the others, are underway, are beginning to be implemented. You'll be very relieved to know, I'm sure, that I'm not going to list the 43 action points. What I'm going to do is just give you a few headlines, really, of our achievements so far. You've been hearing since yesterday about the experience and impact of public involvement in our research programs and in the projects within the FES scheme. And I hope that listening to the experts by experience that are involved in our programs and projects and the academics that are working as partners with them, you get a sense really of the quality, the rich quality of the relationships that we have developed and that we're continuing to develop. The range of impacts that the public who are involved with us as partners are having on our research, and the diversity of those partners. Now, we know that we have some way to go to ensure that the public involved in the school reflect the diversity of England's population. That's our remit, is England. But we have made significant progress on that front. So these presentations so far have demonstrated the rich range of opportunities for lived experience experts to get involved in our research right from the start through to knowledge mobilization. But of course, our public partners are involved across the school in many other ways. At the heart of our strategy and a mechanism for ensuring that is the Public Partners Advisory Network, which we refer to affectionately as the PAN. The PAN meets regularly, and every member of the public who gets involved in the school in whatever way is automatically a member of the PAN and is encouraged to come to those meetings. We discuss ways in which the experience and impact of public involvement can be improved. Academics bring ideas to the PAN for their advice and suggestions, and we advertise involvement opportunities and training and development opportunities through the PAN network. But that's not all the PAN does. The PAN has a number of groups which provide a mechanism for members to get involved in a whole range of school activities. So we have a governance group, for example, And the public members of that group are on our National Advisory Board. They participate in our executive group, which is the central decision-making body in the school. They're members of our public involvement strategy group, overseeing the strategy implementation, and they're a member of the operational group, which is delivering some parts of the strategy. There's also a comms group where public members help us think about our communication strategy. So they've helped us design our website, for example, particularly the Getting Involved pages. And they've also contributed to the business plan for the next 5 years of the school and to our new capacity building plan. And finally, the PAN members have been actively involved in the evaluation that we have just completed, which has looked at how we can improve the experience of our public partners, but also at how we can ensure that their impact, that their efforts are of maximum use and value to the school and to the research, and of course then influencing policy and practice for better health and better health equity. So that report, the evaluation report, will be published on our website shortly. We're just responding to comments from the PAN and from our executive group. But I'm confident that the recommendations in that report will be taken forward in the school to ensure that we are that learning organisation that we want to be. So it's been a real privilege for Michelle and I to work alongside members of the PAN and other members of the school, of course, over the past few years to implement our strategy. We've come a long way. And since the PAN first met in Manchester, actually, six public partners in 2018. And we've had to contend, as everybody has, with online meetings and the constraints of the pandemic. That I'm sure the commitment and creativity of our public partners has got us to where we are now and will continue to ensure that we deliver a rich experience of public involvement. So let's hear from some of those amazing public partners now before you hear from GJ about our future plans. Thanks very much.
Hello, I'm Gillian. Today I'm going to be sharing with you some of my experiences of SPHR public involvement. I have been participating since 2019. Next slide. How did I get involved and why is this work important? I'm passionate about mental health and have spent most of my career in the voluntary sector, working from my lived experience and developing community-based projects that support and empower service users to improve quality of life. The opportunity to bring my lived experience to an audience wider than I had been able to in the past very much appealed. I was new to research and public involvement, but was excited to be learning new skills and meeting people from different disciplines. Through the McPin Foundation, my role as Public Involvement Coordinator and Peer Researcher allows me to share my lived experience expertise in the knowledge that the impact is far-reaching. PPI work is important as it brings the voice of the public and lived experience expertise into the heart of research and ensures that the findings are understood and are meaningful to the public. Next slide. Since I started back in 2019, my involvement has been interesting and varied. For example, I have co-facilitated public workshops to help identify and prioritise the determinants of public mental health. I have broadened public participation across the public mental health programme and have worked towards making research more inclusive and accessible. I have written blogs, co-designed posters, and edited research papers. I have contributed to a lived experience or service user perspective on research design protocols and reports. I have guided the team of public mental health peer researchers, ensuring their voices are heard across the programme and that their work is embedded into the heart of the research. I co-created the buddy system, aimed to close the gap between university-based academics and peer researchers. I continue to be part of a peer-led qualitative research project focusing on inequalities and mental health. Next slide. There have been several highlights throughout my time so far. If I had to choose, there would be two. One, during lockdown, I reached out to the public to find out how the pandemic was affecting mental health and whether people were doing creative work to demonstrate this. I was overwhelmed by the public's response. To document their work, we created COVID Life, a repository of work online showcased on our website, I Am Public Mental Health. The work remains as a legacy to the programme and to the pandemic. 2. In response to a key learning from our PPI report, I, in partnership with the SPHR, co-created the Buddy System, which was launched in 2021. This resulted in 6 buddy pairs made up of university-based academics and peer researchers who met on a regular basis to exchange ideas and knowledge and offer mutual support. We are hoping to expand this opportunity in SPHR 3. Next slide. So how do I see the future of public involvement with the SPHR? In the future, I would like to see an increase in the numbers of people getting involved in SPHR PPI work and to ensure that people who represent our diverse society are actively encouraged and supported to get involved. The SPHR should offer a range of opportunities to public participants, which should extend from one-off light touch involvement to longer-term work. This would enable lived experience expertise to have a deeper, more meaningful impact on research. PPI work often involves so much more than using lived experiences. Payment for PPI should reflect the range of skills that may be required for specific pieces of work and that the public bring into their involvement. Overall, my PPI experience has been both interesting and cathartic. It has given meaning and purpose to my lived experiences of mental health to benefit populations. What better aspiration could there be? Next slide. Thank you very much for listening and do stay in touch. Goodbye.
I got involved in SPHR because it's important for members of the public to not just engage in public health research, but also to be part of co-designing research studies. This ensures that the design is representative of the intended community or patient group. I first became involved using the People in Research website, which provides a list of opportunities for involvement in research studies. I've been involved in various types of research design and evaluation for Imperial College London, University College London and Lancaster University through the range of available opportunities included in the emails sent from within the school. I've also been involved at a broader level, including the SPHR evaluation subgroup, the public partner network known as PAN, and attending the SPHR executive meetings as a public partner. I would say the highlight of my involvement with SPHR has been attending the executive meetings and being able to represent the voice of the PAN. This has involved being included on the agenda of the executive meetings and given some time to relay views of the PAN. One of the things I've been able to address at the executive meetings is the lack of representation of diverse community groups, specifically those that suffer from health inequalities such as Black and minority ethnic groups. And these issues have also been discussed in the PAN meetings. After raising these issues, we've been listened to, and I'm really pleased that changes have been made that will take place in the next phase of SPHR. I would like to see greater inclusion of all the communities that are currently not coming forward or haven't been reached. Public health research affects us all, so a wider representation is necessary. All types of diversity or disabilities are not visible, so it's also important to assess what groups are not currently included and work on a strategy for including those that are not part of the school.
Hello everyone, I'm Margaret Ogden and I'm a public contributor in health, public health and social care. And today I'm going to be talking about public health. I got involved in the SPHR when I made the transition from illness-specific research into public health. And I think I was aware of the importance of the promotion of good health and the prevention of illness. I felt it was crucial to get in early and see what could be done before people became ill. This is certainly on today's agenda as we try and keep people independent living, which is something everyone strives for, I think, as they go through their elder years. My input has been light touch, that is what we know as traditional PPI, giving input at meetings. On the Places and Communities work stream, there are 4 of us, and we each bring our own perspectives. And mine is from living in a deprived area of County Durham, a former mining community, a very vibrant community, a lovely village, but I have noticed variables in health literacy. And this is where I feel I've made the most difference. For example, ensuring information is in understandable language and not pressing complex data onto people. So that's basically where I come from with this. As the principal researcher was deciding the direction of travel for the future, I suggested we do something specifically on health literacy, and he is striving to take that forward. So that's an example of having impact at a macro level, because it's given a steer, but other macro level PPI was on reviewing the website. It contained a lot of research speak and text needed to be understandable and legible and in the correct font. Highlight of my involvement has been working on the PPI evaluation, and this has been quite recent work. While I've done evaluations before, I hadn't been involved from the very beginning. But this time it would be early involvement, starting with the cube. And this was a major development in my PPI, kind of a missing piece of the jigsaw. For the future, I'd like to develop this specialism and perhaps show others how to undertake PPI evaluations. And my other recommendation is on developing mechanisms for feedback. This is an omission we learned about recently. Many of our PPI members in the PAN reported that they did not receive any feedback. And certainly it wasn't on a regular basis. I'd like training to be at the same level as it is in health, because it's much more developed there. And more bursaries and awards to be made available. And thank you for the opportunity to speak to you today.
Hamid, it's my pleasure to sort of welcome you to this. And I know you've had a long involvement with the PAN. I remember you were at the very first meeting of the Public Partners Network back in November 2020. I wonder if you'd like to tell us about how you got involved in SPHR and why you think it's important to be involved.
I got involved in SPHR because I think for me, I realized that to influence change or to make a positive contribution as a public member is to be involved with forums, with working groups, advisory groups, any kind of place and platforms where I can be a voice for those who are not represented or who are hard to reach. I don't like using the term hard to reach, but I'll use in this term, mean those that we don't see very often around the table. And a prime example would be somebody like my mum, who's in her late 70s, has disabilities, has mental health conditions, can't speak the language, yet is a citizen of the UK, does have needs and has cultural sensitivity needs. So that's just one small example, but then there are many other aspects that generally about the health inequalities that we have. And I thought this is a great way to start influencing, supporting, to make a contribution towards a positive contribution in research, to say, have we thought about these other groups, our other underrepresented communities? And also, I think it's great to be able to come and be able to use my lived experience and also to understand the wider context of research and be able to be an outsider in a sense, not being an academic or clinician, but having a stake in being able to contribute, to say, as a patient, as a public member, I think we also need to take this into account or take that into account.
That's lovely, thank you. And can you tell me what you've been doing in SPHR?
I've thoroughly enjoyed myself being part of the SPHR. I didn't realize that how much pleasure I would get out of it in the sense of development, growth, influencing, participation, and at times even leading on something, as part of a task or supporting a task by taking on some of the direction. Like today we're making these videos, even though I'm part of this video, but I'm leading the conversation in terms of there isn't a script for me to read and rehearse. So it happened at the time when there was a pandemic, and being a carer can be quite mundane, quite tiring, quite boring, and being isolated. SPHR came at the right time where I could still be part of something without the barriers of traveling, without the barriers of giving up a whole day, because I could be part of something for an hour, 2 hours. And SPHR has been fantastic, where members of staff, particularly Michelle Collins, who has supported me with understanding my access needs as a carer, understanding my needs as a lay member. For example, data cost can be a big barrier for some people. For some people, it could be other forms of barriers where they haven't got the right in terms of they might not be able to travel for whatever reason, but the online Zoom has helped. If they're carers, they may have carer costs associated. So it's absolutely brilliant that whatever's been able to happen to enable people to participate has been taken into account. And that's something that I'm emphasizing because it's so important to understand individuals and individual needs. And that's one of the things I love about SPHR, that when we come together, we all have different skill set, different experiences, different abilities, but on top of that, being able to be understood about different needs and knowing that everyone around in that forum or meeting have had inclusion being put at the heart of it. And that's what I love about it.
Thank you, lovely. And what's been the highlight of your involvement in SPHR, would you say?
I think one of the biggest highlights for me in the SPHR is the wonderful experiences that come out of SPHR. It's almost like it was it's like you come to it and you think, I'm just going to be attending this meeting and contributing, and suddenly other opportunities come out. I've reviewed documents. I've been offered to take part in other work that's come through the members of SPHR who've got other projects going. I've been part of, like today, I'm making a video which is going to be part of an amazing event, and I'm so happy that I'm going to have a couple of minutes, a platform to be heard and to share and to celebrate, but also to influence the wonderful work that SPHR does and the importance of PPI members.
Fantastic. Thank you very much, Hamid. It's lovely to hear from you today. Thank you.
Hi. So I'd like to thank Jenny Poppe very much for telling us all about the really important work that's been going on in terms of public involvement and engagement and research. And I would also very much like to thank Gillian, Margaret, Hamid, Nurzat for their lovely presentations there, lots of wise advice. And it's been great to hear about their experiences of working with us, and also to hear their ideas for what we need to be focusing on in the future. So thanks to them, and thanks to Michelle Collins, too, who has worked tirelessly with Jenny and Pan over the last five years. It's now my pleasure to introduce Professor G.J. Melendez-Torres, who is the lead for Exeter and is going to be, as Jenny has already said, taking over this important area of work in the school. So great to see you, G.J., and we're looking forward to hearing what you've got to say about your future plans.
Thanks very much, Rona. It's lovely to be here with all of you. So as Rona said, I live in the Southwest and I lead Exeter's membership in the School for Public Health Research. And it's a real privilege of mine to take over the role of Associate Director for Involvement and Engagement in SPHR. The last few months have been a real whirlwind. I spent it learning a lot about the incredible work that Jenny and Michelle have led, working closely with the PAN, the Public Advisory Network, as well as a network of public partners involved in SPHR. And already coming at this from the perspective that effective involvement and engagement makes everything in public health research better, I think I've learned a lot about the incredible force that has been developed around involvement and engagement in SPHR, and that we're very confident will continue into the third quinquennium. Our short-term goals are several. As Jenny said, we've recently finished, or Jenny and Michelle have recently finished, an evaluation of SPHR in terms of its involvement and engagement and with respect to the involvement and engagement strategy. Our first goal is to really focus very carefully on what are the objectives that we now need to prioritize, or the ones that have not been met going forward. Mindful that this is a journey, it's a marathon, it's not a sprint. But thinking carefully about what are the objectives that we need to prioritize moving forward. What are the intermediate things that we can do in terms of activities and actions and outputs that can help us get there? And also thinking carefully, as several of our public colleagues mentioned in their video contributions, about what are the communities that we are not now reaching or that we are not now bringing into the conversation, that we could be bringing into the conversation to ensure that public health research works for everyone and meets everyone where they are and in terms of what their needs are. I've really gained a lot from the enthusiasm and the energy that the PAN bring to this conversation, and from the networks of both senior leaders in SPHR and the Involvement and Engagement Strategy Group, but also early and mid-career researchers who are working on delivering highly effective programs of involvement and engagement. And already we've identified several really promising intermediate things that we can do to really make sure that our involvement and engagement is of high value and that really meets our ethical obligations to the communities that we work with. So over the next few months, we'll be shoring up, we'll be taking stock, and we'll be thinking carefully about what are the first things that we can do to really keep momentum going. I just want to close with my sincerest gratitude, both to those of you who have already welcomed me into this role, but also to Jenny and Michelle for supporting a really exciting transition as we look forward to the next quinquennium of SPHR. Okay, and I think that's over to our next speaker.
Thank you, DJ. And thank you very much to GJ and Jenny and for everybody in that session. Amazing presentations from all our PAN members. So our next session here is to look forward into the next 5 years. But just before I do that, I just want to pause for a moment. First of all, I'd like to introduce you to Professor Penime Adab and a little bit more of way of introduction in just a moment. But before I do that, I'd just like to add my thanks to Jenny for leading and developing the public involvement engagement through this school over the last 5 years, and also Michelle Collins. But I'd also like to take this moment just to thank Professor Rona Campbell, who's led this morning's session. Rona served as the Deputy Director over the last 5 years and has also led our academic capacity development, as you've heard. I would like to add my personal thanks to Rona for her wisdom, her support, and also her friendship. And I'm really pleased that Rona will be continuing in her role as academic capacity development lead over the next 5 years. So as we thank Rona, I would like to again introduce Penime Adab. Penime is the Professor of Public Health at the University of Birmingham and also the lead for FRESH. A little bit more on that later. But Penime will be has been appointed as the new Deputy Director for the SPHR over the next 5 years. And she's going to tell you a little bit about that in just a moment. So I'm really delighted to have the opportunity to work in this way with Penime and also with the rest of the directorate. So I've got a couple of little background slides before I hand the chair over to Penime. So just to remind everybody what you've heard so far across the last couple of days, the school was established in 2012 and our aim is to conduct high quality research, build the evidence base for effective public health practice. From 2022, we're going to build on those 10 years of investment to add value and to realise the impact of health on the public and continue to do that. And I'm really delighted that we have some renewed membership of the school, which includes Exeter, and you've already heard from GJ Melendez-Torres, who's based at Exeter as the lead there, but also FRESH. And Penime leads for FRESH, which is a collaboration between Birmingham, Kiel and Warwick. So you can see that this spreads our geography across the whole of England, and it gives us an exciting platform on which to go forward. So Penime, if you could move to the next slide, please. So what we've been doing so far in terms of our research planning, and what we've been looking to do is build on our success and the landscape which we find ourselves in. And so from September 2021, the new membership of the school was announced, and I've just said who the new members are. And we did a priority mapping exercise, which was supported by the NIHR Innovation Observatory, and also a narrative review of all our members' applications. During October and December, we held a series of workshops, which was an opportunity for the membership to meet each other and to work in consultation with academics across the school, also with practice, policy and public partners, to seek views on programmes and begin to identify our research questions. And that's also included further consultation with members of our PAN. We then submitted our business plan, which was approved in February by NIHR and Department of Health and Social Care. And we've been appointing our research programme leads, and a little bit more on that after lunch. So between March and July, and still ongoing now, we've got research programme planning workshops with representation across the school membership, along with people from practice, policy, public and communities. And those programmes are working to produce programme overviews in the next few months. So at that point, I'm going to stop, and I'm going to hand over to Penime, who's going to give you an introduction to our research programme for the next 5 years before going on to welcome the Deputy CMO, Jeanelle de Gruchy. So, Penny, you're very welcome. Thank you.
Thank you very much, Ashley, and it's a pleasure to be here, and thanks for the warm welcome as a new member to SPHR. I have the pleasure of introducing a little bit about the research programme and the capacity building programme that's planned for the next quinquennium before we hear more details this afternoon. So yesterday we heard about the impressive and wide-ranging work that SPHR has been doing so far, and over the next 5 years we will be building on this. So the research plan for this coming 5 years is under these 4 research themes, which might look very familiar for those who were here yesterday and heard the topics that were discussed before. So we'll be building on the work, that good work that's already been done on public mental health, children, young people and families, and health inequalities, which was a cross-cutting theme in the last quinquennium, and we've heard a little bit about, as well as healthy places and healthy planet, which builds on some of the work that was done earlier. So these 4 research themes we're going to hear a little bit more about this afternoon, and we'll build on the work that's been done. In addition to these themes, we also have health inequalities as a lens for all the work across SPHR, and we'll also be looking at some other areas that underpin each of these in terms of methodological development, including health economics methods. The other important thing within our business plan is that although, as you know, research excellence is at the core of what SPHR is about, but that's achieved in partnership with our practice and policy and public members. So as you've heard already, there is ongoing work, and one of the important principles is to work with our partners. And in order to have maximum impact in the work that we do, there is collaboration is one of the most important principles. Collaboration across school members, but also across outside of that as well, and with our other partners as well. The principles underpinning all of this, in addition to capacity building, which we've heard about already, are around ensuring that EDI, equality, diversity, inclusion, involvement and engagement, and open science principles and knowledge sharing and co-production are key aspects and functions within the work. And each member contributes to work groups that make sure that we have a strategy and develop those principles to underpin all the work that's being done in the school. So just a summary of the funding for the next 5 years. So that the SPHR has a total fund of close to £30 million for the 5 years. Most of that is within the core school budget, the £20.5 million, which is for the research programme funding. But in addition to that, we have 2 exciting new areas of work, building on the work with local authorities, the FEPS programme. Over the next 5 years, you may have heard yesterday, we hope to develop that further to work with perhaps the voluntary and third sector organisations as well to develop public health research in those areas. We've also started an Impact Accelerator Award scheme to look at how we can maximise small budgets that can maximise the work that's already been done within the school and make sure that the impact is achieved. I'm going to talk a little bit about the plans for academic research capacity development and training, which has about £5 million allocated, but we've also reserved some funding for emerging public health priorities. We know that this is an area where we can't predict the priorities that will come along, but there may be natural experiments and other factors that might mean that we could invest in those as they arise. So we'll be doing some horizon scanning with established organisations to try and identify opportunities for that funding. And we also, I mentioned briefly, there are areas of innovation in public health, such as health economics and big data, where there will be some investment in up to 3.4 million, looking at novel approaches for looking at developing public health research methods further. We heard this morning the wonderful work that has been done in the Research Capacity Development and Training Programme, and Rona and a number of alumni and trainees have already contributed to that, and GJ is the SPHR Deputy for Academic Research Capacity Development. Just to summarise, the work will continue in this quinquennium, so the great work on building capacity through summer internships, which we heard about, the pre and postdoctoral fellowships, the studentships, and the Researchers Network funding are going to continue. We also have opportunities through the 3 Schools Network and pre-doctoral placements as well that allow us to work with a number of other people who want to develop research capacity in public health. Rona talked about the transdisciplinary placements and fellowships which are being launched today, so that will also be an additional investment within the capacity building work that's going to happen in this quinquennium. So I think that's the end of all I was going to say, and with that I will come off, and I'd like to move on to introduce our next speaker, if that's okay. So I don't know if Jeanelle is there, but I'd like to very much welcome Dr. Jeanelle de Gruchy. She took on her role as England's Deputy CMO in October last year, and she supports the Chief Medical Officer on health improvement. She's also the co-lead of the Office for Health Improvement and Disparities, OHID. And Dr. de Gruchy started her career in clinical training in South Africa and worked there before also working in the NHS, and has had over 20 years of public health experience. So we're delighted to have her here, and I would like to introduce her to give her talk to us for the next few minutes. Thank you.
Hi Jeanelle, sorry, you're just on mute there.
So it's a fantastic new platform that I'm learning about. So I hope you are too. So, anyways, I was saying it was really lovely to be invited to speak to you all, and as in the intro, you heard background in clinical background in the NHS, background public health in primary care trusts, and then in local authority, and now DCMO nationally. So in all of those settings, research and developing the evidence base has been really, really critical, really important in terms of improving population health. And I think now, particularly as DCMO and co-lead of OHID, to really reinforce that, research, the evidence base is just absolutely critical in terms of the work that we're doing nationally, regionally, locally to improve population health. So I think it's a great opportunity now with OHID to look at how we can really influence. We're much closer into government, and we have now more levers, I think, to act. And there's greater awareness, greater interest from ministers in public health with COVID. Now is really the opportunity and the time for us to try and bring about some real changes, step changes in population health. But as you know, with COVID as an example as well, the intelligence and the evidence base to inform the decisions made by politicians is absolutely critical. So your focus on the evidence base, my focus on what is the evidence base. We've got two very aligned views on what's important, what's needed. And I know that you worked closely with Public Health England during this second phase, and really keen that in OHID we continue to build on that close relationship that you had. And honestly, there's just been, just listening to the presentation of the strategic plan, just been some fantastic advances, I think, for public health research over the last years, and it really looks like we continue to develop and grow in the way that we need to. I know that health inequalities have always been a core aspect of the school's work, but I'm really pleased that that's being enhanced in this next phase, because I think OHID is called OHID for a reason. It's got disparities in the title, and from our point of view, disparities and health disparities, health inequalities are, we see them as the same. And as I said in my intro, the opportunity to influence government policy around health disparities, we've got a real opportunity to do that. And so I see that as really important in terms of continuing to develop the research and evidence base around that. And as you, I'm sure, are all aware, we've got the white paper Health Disparities, which the publication is in the next few weeks. We're hoping for it to be pre-recess. But on, having been part of the experience of developing that, I can absolutely affirm the core function of the evidence base in terms of how we can really clearly advocate for certain policy decisions that, or choices that politicians have. I think in terms of that, there will be specific policies in there. There will be hooks around exploring, considering, piloting, those kinds of that kind of language, where I think are indicating the challenges that we have, but opportunities, and again the importance of the evidence to move those areas forward in terms of getting to some policies and decisions. I think what's been important, what you'll see hopefully, is a acknowledgement of a shift from the focus just on the individual to populations. And I think the research evidence base, the look at how we evidence on population policies is really going to be quite critical to help support that shift, which we all know is a really important one. The role and the responsibility of the state, its policies, its levers, how it works with industry, on collectively how we support a nation to be healthy. All of that, I think, will be signalled through the white paper. And so I think signal where we need the research and evidence base to help continue to push to improve population health. So I think that's where our role is really quite important. And clearly ministers quite rightly decide on the policy, but having the evidence base on which to do that is really important. And that's where you come in. So it's really important that we join up in terms of the research that's done, and how that then informs improvement of population health and policies around that. So I like to think of the two broad areas of research. It's how I look at the broad areas of research that policymakers use. So there'll be policy requested or shaped research and researcher-led research. And that's where we are, so that's where we as policy officials or those informing the policy decisions are part of how we shape the research ask with yourselves. And I'm talking from national but also local, so the whole interconnection with local government and local NHS. Or that's really important. So it's working together, commissioning, helping set direction for the research. So that's really important. Around policy requested or shaped research. That's the first area. And then there's yourselves as researcher and the researcher-led research. And I think that's important as well, where you are producing data, doing research that will be drawn upon to inform policy, perhaps when there isn't an imminent policy request or question, but it will inform and shape the future direction. And clearly there's no clear firm line drawn between the two, but I do think they're slightly different. We don't always know what answers we're going to need in the future. So I do think drawing on how a body of evidence is naturally built over time is really quite important, and again helps shape what our future policy asks or questions might be. So I primarily wanted to thank you all for your role in providing the hard research evidence that we can use to better shape policy. And I think so much of your work is going to be crucial to OHID. I intend for us to work really closely together. I think we will align well in terms of our approach. And I think I did manage to listen to a few of the presentations yesterday, some a little bit live, but actually last night looked at some of the videos, which is exploring this new way of doing conferences. And it really struck me that the approach that you're taking really does align with our approach. And so making sure that we've got OHID and SPHR working very closely together, I think is really important. So some of the things that struck me just by looking at some of the presentations yesterday was that co-production with local authorities to answer some of the most important questions locally, the focus on evaluation, and certainly over all the years that I spent in local government, there were so many opportunities that it just felt such a shame that we hadn't evolved a way to ensure that research and evaluation was integrated with what we were doing in local authorities. And just so many natural experiments, policy experiments, is so many interventions, so many areas that were just begging for research. And I'm really excited about the way in which that area has really evolved over the last few years. And I think for me, it's also that the critical to that is the thinking about not only how is this in one place, but how is it generalizable, transferable, scalable across geographies, while still understanding and appreciating that that actually part of the complexity of a local place is what does or doesn't make something work well. So it's complex areas, it's complex stuff, but I think it's absolutely critical that we do grapple with some of those complexities and ensure that we can learn and improve and support local areas to learn and improve and do things better. And I would say in terms of OHID that a lot of the innovation and the work that's done locally absolutely informs national policy thinking. So it's absolutely critical for us that the work that's done locally is researched, is evaluated, and that it spins back up to national policy decision making. So that's the first thing, that I just noticed there were quite a few examples of that great co-production with local authorities. I really like the developing the diverse cadre of early and mid-career public health researchers with skills and experience. And it's that ability to have a career both in academic and in practitioner-based research, because I do think that's really important, having that knowledge, experience, understanding, lens of of how the research, the evidence-based links into practice is really important. And there was some input from trainees who based both in local authorities and doing research. And I think bringing those two together in the training program is quite important, because I think, my experience I'm talking quite a long time ago, is sometimes, the trainees who are doing academic work and then local authority, the two just didn't seem particularly connected at all. They were sort of two completely separate spheres, and that can't be right. We need to bring those spheres together so that they are complementary. So I think it's great for us to draw upon those insights and that work, and the trainees to develop those skills and insights as they go through their careers and become more senior in their careers. So it's great to have those that multidisciplinary interaction and integration between praxis and research. It's really great. And then the third point I wanted to make was just around the reach across. Well, yesterday there was research, wasn't there, about social housing and other wider determinants research, which again is really important in terms of the wider determinants work. OHID wanting to reach across government. So we've got the Prime Minister's Health Promotion Task Force, which is one vehicle for doing that. You'll see in the white paper that clearly there were lots and lots and lots of conversations across different government departments. The research base to enable our OHID officials to have those conversations with officials in, whether it's DLUC or the Treasury even, or Home Office, Department for Transport, all of that, having the evidence base to advocate for particular policy choices is really, really important, again, in terms of that. So it really fits with your aim to increase input from the other academic disciplines, such as engineering. So the work that CMO is interested in around air quality, clearly, we need to draw on the research of quite a wide range of other disciplines, that an interdisciplinary nature or multidisciplinary nature of the research is quite important. So very pleased to hear about looking to fund and develop more that broader interdisciplinary workforce. So I think the public health challenge that we're facing do require us to have a much wider sense of those different, the input from those different disciplines. So lastly then, I wanted to just briefly set out some of the ways that in OHID, some of our priorities, they map across nicely to the strategic priorities that you've set out, of course. And so just in general sense, I think it is about both strengthening and supporting the public health system. And I think I've spoken to that. So it's definitely one of our priorities. And the public health system, as I said, does include the way in which we link across to you in the School of Public Health Research and research more broadly. So I think that's really quite important. I think there's some key policy areas that that are picked up as part of your strategic plan that will be really important to us. The white paper will signal, as I've said, some other key areas where research is going to be really quite important to us. So that system strengthening is important, ensuring that we've got effective delivery from the national to the regional to the local. And there was examples of research I saw yesterday around delivery and delivery mechanisms and evaluation of that. So I think that's going to be really quite important. They'll focus on the workforce and ensuring that we take the workforce forward with us. So I think I'm going to stop there in terms of the priorities and see whether we've got, I hope I haven't overrun, but see if we've got some time for questions. Oh, sorry, you're on mute yourself now.
Thank you very much, Jeanelle. Sorry about that. That was a really helpful overview and really appreciate it. I think we have at least one question. So Monique is asking, I think you've partially answered this, but asking how can we as a community best work with OHID to ensure that our work has impact?
Yeah, so on that, I think, so working through the School of Public Health, and we clearly as OHID have those links to the school. I think that's that. So just being part of the school is quite important, and the university is connected into that. I think having those relationships, you know, in the areas of expertise, and ensuring that you have that link through into OHID regions. I think our regions are really quite important. So it depends a bit where your research is based and what kind of research it is. So it might be that you would link into particular regions or networks like FRESH on tobacco. So there's that kind of link, isn't it? And I think that's quite important because the regions in turn will be very much integrated into the national OHID work. There might be particular policy areas where you would want to have a relationship into national policy teams and so on. I really do think that kind of relationship and being close to really understanding what it is and where those what kind of research is needed, what the areas of the research are, being able to see where different policy choices are going, what opportunities there are in terms of making a difference. I think all of that comes through the stronger relationship between the research community and the practitioner community, between the school, for instance, here and OHID. I really do think that, which is why I'm really pleased to have been able to come and speak to you directly.
Thank you, that's wonderful. And we've also got a question from Ashley asking about whether you could say a little bit about how we can facilitate and reduce burden to OHID barriers, to data access for research through OHID.
Okay, so that's going to take more than
I guess highlighting it as an area to discuss, maybe.
I highlight that it's an area to discuss data, absolutely. Yes, exactly. No, so very keen that we're involved in some of those data discussions as well. And if there are things that we can do to help facilitate, then it's absolutely critical that we know about that and what it is that we might be able to do.
Thank you. I don't see any other questions. Unless I'm missing them, I will say thank you very much again, Jeanelle. And it's been really a pleasure to see you here, and thank you for representing OHID and working with us through SPHR.
Thanks so much, and lovely to be able to speak to you. Thank you.
I think we're now moving over to the lunch break. So I'm just checking. So just to let everybody know that the expo booths and the people's area for networking are open over the lunch break. And we'll be back at 1 o'clock to hear about the research programs, which I've touched about this morning. So have a good break and see you all at 1 o'clock. Thank you.